What is food poisoning? Food poisoning happens when you consume food that has been contaminated. This contamination might come from harmful organisms such as bacteria, fungi, parasites, or viruses. Occasionally, the toxins produced by these organisms are the culprits behind food poisoning. When you ingest something harmful, your body reacts to eliminate the toxins, often through vomiting or diarrhea, and sometimes both. You might also experience a fever. These unpleasant symptoms are your body's natural way of trying to restore your health. Typically, the symptoms subside within a day or two. Who gets food poisoning? Anyone can contract food poisoning from eating contaminated food, but certain individuals are more susceptible. The likelihood of getting sick depends on the amount and concentration of the toxin ingested. Your general health also influences your risk. Your immune system continuously fights off infections, often without you being aware. Despite proper food handling practices, a small level of contamination in food is common. How do I know if I have food poisoning? Identifying food poisoning can be challenging, especially if symptoms take a few days to appear. However, you might suspect food poisoning if you consumed something often linked to foodborne illnesses. Someone else who ate the same food also became ill. What are the symptoms of food poisoning? Food poisoning typically presents with the following symptoms: diarrhea, nausea and vomiting, abdominal pain and cramping, fever, headache, weakness. How quickly does vomiting occur after food poisoning? The onset of vomiting after food poisoning varies based on the type of infection. Some common bacterial infections can cause symptoms within a few hours, while others need time to incubate and may take a few days or even weeks before causing illness. How do you get food poisoning? Food poisoning occurs when you consume contaminated food or beverages. Common causes of contamination include food that is not fresh, thoroughly washed, handled hygienically, cooked to a safe internal temperature, stored at proper temperatures, refrigerated or frozen. Promptly, food poisoning can happen anywhere, but it's particularly common when traveling abroad due to exposure to unfamiliar germs. This form of food poisoning is often referred to as traveler's diarrhea. What types of contaminants cause food poisoning? Food and water can be contaminated by various substances, including bacteria, viruses, parasites, fungi, toxins, chemicals. There are over 250 specific types of food poisoning, with some of the most common causes being salmonella, often found in raw eggs and undercooked poultry, but also in beef, pork, vegetables, and processed foods. It's the leading bacterial cause of food poisoning in the U.S., resulting in the highest number of hospitalizations and deaths. E. coli, typically present in undercooked meat and raw vegetables. E. coli bacteria produce a toxin that irritates the small intestine. Listeria, found in soft cheeses, deli meats, hot dogs, and raw sprouts. Listeriosis, caused by Listeria bacteria, is particularly dangerous for pregnant individuals. Norovirus, contracted from undercooked shellfish, leafy greens, fresh fruits, or food prepared by an infected person. It's the virus most commonly linked to stomach flu. Hepatitis A, spread through contaminated shellfish, fresh produce, or water and ice. Unlike other hepatitis viruses, it is not chronic but can still impact the liver. Staphylococcus. Staph infections occur when bacteria are transferred from hands to food, commonly affecting meats, poultry, dairy products, salads, and cream-filled baked goods. Campylobacter. This bacterial infection, which causes severe gastrointestinal upset, is often linked to undercooked poultry, meat, eggs, poorly processed meats, contaminated vegetables, and raw milk or water. Cross-contamination also spreads it. Shigella, typically found in uncooked vegetables, shellfish, and mayonnaise-based salads like tuna, potato, macaroni, and chicken. It can cause bloody or mucus-laden diarrhea, sometimes referred to as bacillary dysentery. Is food poisoning contagious? Yes, food poisoning can be contagious. The infection can spread to others if they come into contact with germs from an infected person. Germs can transfer through tiny particles of vomit or feces that remain on surfaces or hands and then make their way to another person's food or mouth. Who is most at risk from foodborne poisoning? Certain individuals are more susceptible to food poisoning or may experience more severe reactions due to a weaker immune system. Factors that can affect immunity include age. Children under 5 have developing immune systems, and immune function declines after age 65. Pregnancy. Pregnancy demands significant resources from the body, reducing the ability to fight off infections. Chronic illnesses, conditions such as infections, cancer, immunodeficiency diseases, and autoimmune diseases can weaken immunity. Medications. Drugs like corticosteroids and immunosuppressants can suppress the immune system, increasing vulnerability to illness. What are the possible complications associated with food poisoning? Although complications from food poisoning are uncommon, they can be severe and, in some cases, life-threatening. The most frequent risk is severe dehydration, but certain infections can lead to specific complications, such as miscarriage and stillbirth. Listeria infection is particularly hazardous for a developing fetus, potentially causing neurological damage and death. Kidney damage. E. coli can result in hemolytic uremic syndrome, HUS, and kidney failure. Arthritis. Salmonella and Campylobacter infections can lead to chronic arthritis and joint damage. Nervous system and brain damage. Some bacteria or viruses can cause meningitis, a brain infection. Campylobacter, for instance, can trigger a neurological disorder called Guillain-Barré syndrome. How is food poisoning diagnosed? To diagnose food poisoning, your healthcare provider will inquire about your symptoms and recent food and drink consumption. Depending on your symptoms, they may request a stool sample or a blood test to identify specific parasites or bacteria. Will food poisoning go away on its own? In most cases, food poisoning resolves on its own with supportive care at home, primarily focusing on staying hydrated. Diarrhea, vomiting, and fever can lead to significant fluid loss, so replenishing fluids is crucial. Hydration solutions like Pedialyte, TM, or other electrolyte-balanced drinks can be especially helpful. These solutions help retain fluids and electrolytes in your body longer. If you or your child have difficulty keeping fluids down or show signs of dehydration, you may need to seek medical attention for intravenous IV fluids. Do I need medication for food poisoning? Some types of food poisoning may require antibiotics, and your healthcare provider will determine if they are necessary for your specific infection. However, antibiotics are often not needed and can sometimes worsen the condition. Healthcare providers generally avoid prescribing antidiarrheal medications for food poisoning as they can prolong the illness. You might find relief from some symptoms with over-the-counter options, like bismuth subsalicylate, Pepto-Bismol R. How can food poisoning be prevented? Preventing food poisoning primarily involves safe food handling practices at every stage, from harvesting to preparation. Key practices include clean, thoroughly wash raw produce in clean, sanitary water. Wash your hands and utensils before preparing food. Clean and disinfect all surfaces that will come into contact with food, such as cutting boards, countertops, and plates. Separate. Prevent cross-contamination by keeping raw meats and eggs separate from fresh produce and other food items. Cooking meat properly kills germs, but if those germs transfer to uncooked items, they can survive and cause contamination. Cook. Ensure meats and seafood are cooked to proper temperatures to kill germs. Whole cuts of meat can be pink inside if well seared outside, but ground meat should be cooked thoroughly with no pink remaining. Fish should be opaque and easy to flake with a fork. Chill. Refrigerate or freeze prepared foods within 2 hours of cooking to prevent bacterial growth. Keep foods with gravy, sauces, mayonnaise, or creams at proper temperatures while serving. Regularly check refrigerated foods for signs of microbial growth, like mold, and discard dairy products past their expiration dates or with an off smell. Additionally, stay informed about public health announcements regarding food recalls and outbreaks. If you experience food poisoning, report it to help prevent further cases. What is the outlook for people who have food poisoning? Most individuals recover from food poisoning within a few days without medical intervention. However, severe reactions may require medical attention, especially due to dehydration. How long does food poisoning last? Typically, food poisoning resolves within 24 to 48 hours as the body expels the infection. However, it may last longer if there's a high level of toxins, if the immune system is weakened, or if a parasitic infection requires specific treatment with antiparasitic drugs. When can you return to work or school if you have had food poisoning? If possible, stay home for at least 24 hours after your fever subsides. Inform your school or workplace about the infection, and especially if it was contracted there. What should I eat and drink while I'm sick with food poisoning? Initially, allow your stomach to settle before consuming food or drinks. To stay hydrated without upsetting your stomach, try sucking on ice chips. Fruit juice, ice pops, or gelatin can also provide nutrients, electrolytes, and calories for energy. When you feel ready to eat, start with small amounts of bland foods. Options like broth and crackers or toast are ideal. The sodium and water content in the broth can help with rehydration, while crackers add bulk to your stool. What makes food poisoning worse? Certain foods and drinks can exacerbate food poisoning symptoms, including fatty and fried foods, spicy foods, dairy products, caffeine, alcohol, high-fiber foods, nicotine, acidic foods. When should I call my healthcare provider about food poisoning? Contact your healthcare provider if you are pregnant or breastfeeding, or if you are caring for a child under 5 or a person over 65 who is struggling to keep fluids down, as these age groups are more susceptible to complications from dehydration. Additionally, seek medical attention if you or your child experience any of the following symptoms: persistent high fever over 102 degree and 38.90, bloody diarrhea or vomit or inability to keep anything down orally, dark urine or lack of urination, blurred vision, delirium or confusion, dizziness or lightheadedness. A note from Optimal Best Health. You probably feel awful right now with symptoms like diarrhea, vomiting, and fever. These are signs that your body's working to eliminate the toxin causing food poisoning. The good news is that food poisoning usually resolves within a day or two. Focus on staying hydrated and allowing your body to fight it off. If your condition persists or you develop more severe symptoms, consult your healthcare provider for treatment. If this video was helpful, give it a thumbs up and subscribe for more health tips.